Hello, great people. Welcome once more to my channel where I teach, provide lectures on male reproductive health. If this is your first time or you have been watching my videos and you have not yet subscribed to my channel, please, I want to encourage you to do so because I have a whole lot of lecture videos to share with you as it pertains to male reproductive health. Today, I have a very interesting topic I want to talk about, and that is erectile dysfunction, otherwise known as impotence. So I'll take you through the content of the work, beginning from introduction. Then we'll look at the causes of erectile dysfunction, available treatments, options, and we'll wrap it up. So do not be in a hurry to disengage from this video. Stay tuned to watch it all through so that you get the best out of it, particularly when we'll be looking at the treatments available. Okay, so very quickly, let me take you through the basics. Let's get some definitions right. What exactly is erectile dysfunction? Erectile dysfunction is usually abbreviated as ED or ED, but otherwise called impotence, is a male reproductive disorder. It's a male reproductive disorder where you know a man is unable to maintain erection for sexual intercourse. But however, this has to be persistent. So it is characterized by the persistent inability, take note of that word, persistent inability to achieve or maintain an erection firm enough for sexual intercourse. So you know that to be able to, engage in sexual intercourse, to be able to do that, your erection has to be firm enough to achieve penetration. Looking at the images on the slide, you could see, you know, you could see the first diagram there showing that the penis is falling and the other one is erect. Take note of the color of that erection. Take note of that penis that is erect because I have a whole lot to tell you about that. So take a note of that. We'll talk about it as we proceed. Okay. So having understood that, let us look at the causes of ED. I want to broadly categorize the causes into two: physical causes and psychological causes. Let me hurriedly take you over to physical causes. All right. In physical causes, we could have issues like neurological disorders, neurological disorders where the nerves are affected, such as conditions like Parkinson's disease. If you could remember Parkinson's disease, you see some persons, particularly at old age, it's as if their hands are shaking and all of that. So some of these things are neurological disorders. And when the nerve that is responsible for erection is affected, then someone can come down with ED. Someone can come down with ED. So I need you to know that what makes you see your opposite sex and you feel erect, you know, is because your nervous systems are working, your nerves are working. The function is there. Is that part of human characteristics that is responsible for what we call irritability, in the characteristics of living thing, irritability, the sense of touch, feeling, and all of those things. So your nerves have to be working for your erection to work. Another cause is hormone imbalance. Hormone imbalance. When some persons could come down with low testosterone level, one may want to say hypogonadism, decreased level of testosterone. And testosterone is very vital for a man. Very vital for a man. That's the vitality. That's the strength. In fact, it has a very critical role in male fertility. Both male fertility and male impotence. Remember, these two things are different. These two things are different. Male fertility and impotence in bracket erectile dysfunction, are two different things. They could happen, and many times they happen simultaneously, but it is not always like that. But testosterone plays key roles in both of them. So if we need to achieve the firm erection that is enough for sexual intercourse, then we must not underplay testosterone level. Another physical cause is medication and prostate surgery. You know, there are certain drugs we take to treat certain things that at the same time have effects on us. One very example are antihypertensive drugs. Sometimes in taking this drug, in treating hypertension, we are at the same time causing compromise, or we are compromising our erection. This leaves you with this note that every drug is a poison. I learned about this several years ago when I was still in school, told that every drug is a poison. Because you see, in course of treating one thing, it may be doing something else. Yes, it could be treating what you want it to do, but at the same time, it may be causing one or two ill feelings. Sometimes you take drug, you're having headache. You take drug, you're feeling like vomiting. Those are some side effects of the drug, some adverse effects of the drug, which you never bargain for. No, your intention is please take this sickness away. But it's doing that, and at the same time, it could be causing something. So that's why we said drugs are poisons. Yes, they are safe, but at the same time, it could be poisonous. That's why I strongly recommend that you don't just wake up in the morning and start taking drugs. Self-medication could be dangerous. You need a health professional to guide you on how to take those drugs, because as good as they are, they could also bite you dangerously. Okay, then prostrate. In the process of surgical intervention for prostrate, it could there could be cases where the vein or the nerve could be affected. So you see that it's also a treatment. It's also a treatment, but as the treatment is going, one or two things may be affected. The truth is that if I cut your skin today, there is certainly a compromise on the integrity of your skin. That is why when you have an injury and the injury is large, there will be scar. When a scar is formed, that skin has lost functionality on that scarred area. You can hardly find hair growing there. Well, hair was growing before, but now hair is no longer growing because there's a loss of a function of that skin. So another one could be by running, scar tissue in the penis can lead to curvature or pain during erection. And I was just talking about this same thing too. Let's take for example this whole scarring thing and loss of function. When someone is burnt by fire, just take a look at this hand. You see now, see the way I'm moving this hand? There's nothing wrong with this finger, sorry. You see the way I'm moving it? I can move it as much as I want because it's functioning. But if for any reason there was a fire incident and my finger was exposed to that, this finger that was moving like this now became like that. It's unable to move anymore. It's unable to move just like that. You see that? A scar has been formed, and although the finger is still existing, you could still see it, but the function of this finger has been compromised or reduced. Reduced. What it could do before, it cannot do because of the scar. When someone is burnt with fire, scars are formed. So when scars are formed in anywhere, there is a loss of function, a loss of the original function of that tissue. So when there are scars, injuries in the penis, they could form scars and also affect the erection of the penis. Then problem with blood flow, maybe obesity, anything that could affect the flow of blood, causing narrowing of the blood vessel. Remember, I made mention of what's it called? When I was showing you the picture of an erect penis and then a penis that is not erect. The one that is erect was red. Was red, and I said I was going to tell you about it. Because what causes the erection, what makes the penis to be erect, to maintain that erection, is the blood. So when blood flows into the penis tissue, into the penile tissue, it becomes studied, it becomes firm, and is able to stand erect. So if your blood vessels are affected, you have issues, you have cardiovascular issues, heart issues, you have issues with your blood vessels, the flow of blood, then there will be a problem. That is why when I'll be talking about the treatment, one of the things I'm going to mention is exercise, because it allows flow of blood, free flow of blood. It allows free flow of blood. So you see that when you are hypertensive, there's an issue with your circulation. There's an issue with your circulation. When there's obesity, when there's obesity, you are at risk. When there's high cholesterol in the system, you are at risk of coming down with ED, because they will all go in, including diabetics. They will all go in to cause narrowing of the blood vessels that are needed, the blood vessels that are supposed to carry sufficient blood in the penile tissue to make them erect. Since they will become narrow, they will not be able to carry sufficient blood, and the erection will be weak. Okay, so let us look at the psychological causes. Psychological causes. Beyond the physical causes, we could also have psychological causes, something from the mind. Depression, your mental health is very important in maintaining erectile function. There are several studies that have shown a relationship between depression and weakness of erection. So you want to ensure that you are emotionally stable, you are emotionally healthy. Avoid going into depression if you want to maintain erectile functional status. Then your relationship issues could also precipitate erectile dysfunction. You could have a problem with your wife, could have a problem with your wife, and that could contribute to your performance. Because you see, sexual intercourse is to a greater extent a thing of the mind than a thing of the mechanical action that we see. It's a thing of the mind. So the mind has to be healthy. So people who have relationship issues are also likely to come down with erectile dysfunction. Guys, take note. So follow peace. Worrying about sexual performance can create a self-perpetuating cycle of anxiety and ED. Worrying about sexual performance. This is why this video is also important for women. I'm going to talk to us. This is why this video is also important for women. You see, some men have been talked down so badly that it has even affected their erection. Not that physically anything is wrong with them, but because of their partners talking badly about maybe their sexual life in very derogatory and disrespectful way, it has put them into a close where they can't maintain erection whenever they are before you. Yeah, so try to see how you can heal. You can be a psychological support and benefit to your husband, your partner. Tell him how good he is, how fantastic he is. Encourage his mind so that he can do better. For example, a woman tells her man that, "Look, oh, your performance last time was horrible." That sinks into his brain, and it will take time for that to leave. Each time he comes before you, he feels he's incapable. He feels he feels he's incapable to satisfy you. So that brings him straight away to depression. There was a case of a man who came with his wife to the hospital for a test, and just asking him alone to, produce semen for semen analysis to check if it's fertile or not. The man went straight into the man lost erection completely. He lost erection. He had to be, um, he had to be begged, pleaded. See, please, we are no longer doing this. We are no longer doing this. Don't worry, you are just fine. That tells you the state of the mind, the role of the mind in our health. We can't underestimate it. All right, so high level of stress and anxiety is also a cause. It can cause erectile dysfunction, can interfere with our sexual performance, and of course lead to ED. So take sufficient time to rest. Perhaps that's why the rate of erectile dysfunction is growing so fast in our time, because the level of stress in the society today is so high. The level of stress in the society today is so high. People are trying to meet up with the ever increasing standards in the society. So please, in all our pursuit, let's try to maintain a mental health. Let's try to maintain a healthy psychological status. Okay, so available treatments. Let's look at this. There are quite some treatment options available for erectile dysfunction. I'll just mention them and then. But in subsequent videos, we'll look at them one by one per video, so that we'll have enough time to exhaust what we need to. So, but in this case, I can just list them out for you and just give you a surface knowledge on them. Lifestyle changes, maintaining a balanced diet, regular exercise. Are you seeing the regular exercise I mentioned? Oh, yeah. So when there is sufficient exercise, blood flows to everywhere, the brain everywhere. Blood flows anywhere blood is unable to get to. Listen to me. The place dies. The place dies. That is what happens when you hear of cardiac arrest, when you hear of let's say, heart attack, when you hear of myocardial infarction. This is what happens because blood is not reaching certain areas. Those areas begin to die. So one thing that helps push blood to those areas is when you're physically active. So that you have not done anything so physical, you've not physically engaged yourself by way of exercising throughout a week. It's not something to rejoice. It's something you should be crying because you aren't helping yourself. Maintaining healthy diets. I'm actually writing a book on that. When the book is available, I'll let you know. I'll let you know. Quitting smoking and alcohol. I'm going to talk about this much later, maybe in another video. The role of smoking and alcohol and how it affects your erectile function. I'll give you, you know, I'll give you the mechanism how this happens so that you run away from smoking and alcohol if you want to maintain a healthy erection. Medications, oral medications are there. Viagra, they are very popular. You could even get them from the pharmacy, and then they are all there to boost your erection. And the way they do this is by pushing. They try to push in blood into the penis. Pushing in that erection picture I showed you, you saw that the erection was red. It means blood. Enough blood is pulled in there. So what this drug does is to push in blood into the erectile tissue to give erection. Then psychological therapy, yes, when it's something psychological, emotional, the mind, mental health is involved. You need you need counseling. You need counseling to be able to address all that. Then we have some other therapeutic interventions such as vacuum erection devices. It can help you. It's still acting under the principle of pulling blood. It pulls blood to the penis. When it pulls blood into the penis, then it's able to, some come with a ring, it's able to entrap blood for a period of time, about 5-10 minutes, so that one could engage in intercourse, sexual intercourse, while maintaining a firm erection throughout the process of time. Penile implant. This comes with a sort of plastic rod or some a malleable rod that is implanted into the penis. Yes, to enable it to have an erection. This comes in usually a severe case of ED when all interventions aren't working. Then this could be like one of the last options to take to, to treat the condition. Hormone replacement therapy is also there in cases of hypogonadism when maybe testosterone level is low. Then you need to boost it up because when testosterone level is low, certainly the fellow will come down with erectile dysfunction. Then there are emerging treatment options coming up. Yes, in fact, one came up in 2010. One came up in 2010, and here in Nigeria, the treatments are not very common. Just very few hospitals. I was reading about an article somewhere, a study that was conducted on this therapy in um, University of Ibadan Teaching Hospital, and I learned of one or two in Port Harcourt. So this is an emergent therapy just came in, and then lots of research works are currently undergoing on this. It is non-invasive. In fact, it's one of the most interesting treatment interventions because it is non-invasive. It's not something you're taking inside. It's not something that requires an injection. No, it's not. It's something mechanical. Wave introduction, shock waves are the penile tissues are exposed to shock waves. Then those waves cause regeneration of the penile tissue, new growth of new blood vessels called angiogenesis, and and all of that, and even repair of damaged blood vessels and tissues. So that's just very interesting, very remarkable. I tried to do some review and studies on that, and honestly, the treatment rates, treatment successes have been great, have been wonderful. So another emerging therapy coming up is stem cell therapy, another miracle. But when you talk about regenerative medicine, stem cell therapy is at the center of it. When you try to bring what is dying to life, stem cell is a kingmaker. All right. So, in conclusion, why ED can be distressing, it is highly treatable condition. Seeking medical advice and open communication with healthcare professionals are crucial for addressing the issue and finding the most appropriate treatment approach tailored to the individual's unique circumstances. Maintaining a healthy lifestyle and managing stress are also important things to consider. So thank you for watching, and I'm happy that you were part of this video. For you to be here today, I know that you have gained a whole lot on this topic, erectile function. I believe you've been able to create a very good, you know, knowledge background for you to understand all of these things, and for you to be able to take informed decision or provide counsel to those who may need it. So thank you once more for watching. Thank you. Please do not forget to like, subscribe, comment, share. If I do everything you can do, to be a help to somebody, so that you too will be helped tomorrow. But don't forget to subscribe so that when I make more videos, you'll be among the first to receive the notification. Thank you. This is brought to you by Dreams and Realities. Thank you. Thank you.